International Society of Acupuncture and Meridian System 2019. I'm Houghton from Fudan University, Shanghai Cancer Center. Today my topic is acupuncture in relieving pancreatic cancer pain. As we all know, based on the epidemiology from the CA, it's a very famous magazine in the world. In the United States, in 2018, the estimated new cases of the pancreatic cancer is a minority cancer. Only in female, only in female is the number 8, for the male, it's not the top 10 cancer, but for the estimated cases, all the men or female is number 4. So it's a deadly disease. We see it's the king of the cancer. We can see the stage of why it's a deadly disease. We can see when initial diagnosis, the most of patients were distant or metastasis. Only less than 10% of patients can receive the operation. After the operation, only 25 patients can live more than 5 years, but most of the other patients, the 5-year survival is less 10, and totally is 5-year survival is less than 5. So why we do the research for the pancreatic cancer? Firstly, pancreatic cancer is a disease with dismal prognosis, and the second is about 90% of these patients reported significant abdominal pain or back pain in all his life. So we want to give these patients a chance to relieve the pain and prolong this patient's life. And the pain management is one of the key parts of rehabilitation therapy. So we want to do the research to how can we do to relieve this pain. Firstly, we can see the mechanism of the pain. Pancreatic pain is different for the other diseases. Firstly, it's infiltrating in peripheral nerve, and secondly, is involved the critical restrictor surrounding the pancreas, just like the spleen, the gas, GI, and sometimes he will remove the liver. And we can see about 75% of patients present with pain at the initial diagnosis. So sometimes in the clinical outpatients say he had a back pain or abdominal pain. But for these patients, it's not the early stage phenomenon. It's relieved the advanced or sometimes have the metastasis. Pain is linked with depression and anxiety. Some patients cannot can have a sleep for the pain. So we should do something for the pain. And as we all know, the treatment of pancreatic pain, we can use the analgesic later based on the WHO 3 later, and the neurology, silica plus black, and the radiation therapy and the chemo. But all these treatments have the side effects. Sometimes the patients cannot tolerate, they may have vomiting, have the other side effects. So can we have another option can do for these patients? It's the WHO 3-step analgesic later. But sometimes the patients have the uniform effectiveness, desired side effects. So we can do what? We can use the traditional Chinese medicine, especially for the acupuncture, to relieve the pain, increase the safety, and increase the efficiency. We designed this study to evaluate the analgesic effect of electric acupuncture, not only the acupuncture, electric acupuncture for pancreatic cancer pain. And so we designed this study for a prospective, randomized, and placebo-controlled trial. It's blinded patients and blinded evaluation and the statistical analysis. So we can provide this. And the patients, we recruited these patients from Fudan University China Cancer Center from April 2015 to March 2017. The inclusion criteria, firstly, these patients should aged from 18 to 75 years old and historically confirmed advanced pancreatic cancer at stage 3 to stage 4 and pancreatic cancer in AGCC number 8. And the pain intensity from 3 to 6 on NIS graded from 0 to 10. A stable dose for analgesic at least 17 hours before randomization. It's very important, as we thought to the patients, he cannot change the analgesic. If he changes the analgesic, he should retreat this study. And the PS state is less than 2. And the estimated survival time is more than 1 month. For this patient, it's very difficult. They have pain, but if the patients, the survival is less than 1 month, this study, we think it can affect our result. And never being treated by acupuncture. Why we should write this in China? Most of people know acupuncture. They sometimes know how to touch and anything. So we should, this patient should confirm he never received acupuncture. The exclusion criteria, firstly, is having any disease leading to the experience of pain. And the second is having contraindication for the use of acupuncture. And then the third is having history of cerebral accident or spinal cord injury. And we grouping based on the randomized number table and the specified NIS for pain intensity 3 to and 4 is one group, and 5 and 6 is another group. This our treatment, we use the electric acupuncture Judge point from T8 to T12, and the Philippine needles were inserted to a depth 25 millimeter. We use the hand acupuncture nerve stimulator just like this, from T8 to T12 judge and the depressed death waveform, and we use the 2 to 100 Hz or 1 milli A. And for the placebo acupuncture, we use the judge points from T8 to T12. It's same to the treatment. And the placebo acupuncture needles, the placebo acupuncture needles is from South Korea. It's blend tables without inserting, just to have a little bit feeling, touch to the skin. And we open the hands acupoint nerve stimulator, but to use the zero frequency and the electric. This is the treatment. We use once a day for 3 days and 2 days follow-up, and maintain the same analgesic drug treatment. We told the patients if he changed the drug, he should tell us. This we use the measurement for the pain intensity, use the numeric rating scales. 0 is the middle and the moderate and the 7. We chose these patients is from the middle to moderate. It's a static use the chi test and the independent sample T test and the paired samples. It's the results. So we totally recruited 92 patients, but we declined 32 patients for some reason and considered and randomized totally is 60 patients. We divided 2 groups based on the number. Electric acupuncture group 30 and control group 30 patients, but in the control group dropped 1 patients for he changed his drug. But we analyzed all the patients for 30 and 30, and after 5 days follow-up, we analyzed all these patients. It's the baseline of these patients. Two groups have no difference for two groups. It's better for the general baseline pain. Baseline pain is the same, and the maximum level analgesic drug. And the stage of cancer, primary site and metastasis, it's no different between two groups. It's a result you can see in the control group. There are no difference after 1 day, 2 day, and 3 day sham treatment and 2 days follow-up. But for the electroacupuncture group, the first day the score declined 2, and the second day and the third day after treatment, they also have the effect to control the pain. And after 2 days follow-up, they also have the effective to control the pain. So we do the statistic. The t-test is less than 1.001. All this in this trial, there are no infection at treated points, and no other adverse events were reported by the patients and recorded by the clinical, so our clinical nurses. In this study, we can demonstrate that electroacupuncture was an effective treatment for relieving pancreatic cancer pain. It's the first randomized clinical trial to demonstrate that electroacupuncture can relieve pancreatic cancer pain. We published this paper on the Pancreatology. It's a professional magazine for the pancreas. It's a standards that we can do. Standards acupuncture treatment with the same point was used for each patient. The subplaceable needle was used, but it had some problem. When we published this paper, someone commander gave us a good suggestion. So for the next research, we will receive this suggestion to do the sham, how to do the clean needle, and do the table. Let the patients write the table. He received the sham acupuncture or for the electric acupuncture. So it's a single center trial, and the study population was somewhere was selected, and only 2 days follow-up. So for the next study, we will follow up 7 days. So we will do the multi-sample large-scale randomized trial and the longer duration of treatment and the follow-up. We will do 5 days treatment and 1 week follow-up. And this protective magazine, we will do functional MRI and we want to do the several pancreatic cases, but we just choose the moderate, middle, and moderate patients. So in the future, we will choose the several pancreatic cancer pain. We want to divide the two groups. One is middle and moderate, and one group is for the several pain. Thank you for your attention.